So, chapter 16 is about lasers and light. So, it's really the beginning of the section in the book talking about electromagnetic agents, even though we've already talked about diathermy and biofeedback. But lasers and light are a specific application of electromagnetic radiation. The last chapter we'll talk about is chapter 17, which is UV radiation. So, for the learning objectives, of course, indications, contraindications, and precautions, as usual. I want you to briefly describe the effects of laser. Really, just to know what the acronym LASER stands for, because it's an acronym. And the two main parameters for laser and how they affect treatment. So, pretty basic. Electromagnetic radiation, it's whether we're talking about diathermy or lasers and light or UV light, it's basically electrical and magnetic fields that vary over time and are oriented perpendicular to each other. So laser, the acronym, stands for light amplification by stimulated emission radiation. That's the acronym. That's what it stands for. And we'll talk about its specific properties in a minute. A light-emitting diode, or LED, is a semiconductor diode light source. Low-level laser therapy is the application of laser light for therapeutic purposes. So there's several different types of therapeutic laser applications: cold laser, low-intensity laser, low power, or soft laser. Lasers are also used for lots of different non-therapeutic applications, and we'll talk about the individual therapeutic applications and why they are used or not used in PT settings. So, light is electromagnetic radiation in the visible range, right? So that's that rainbow. Most light is polychromatic, that is, of various wavelengths. And laser light is monochromatic, coherent, and directional. So it has a single wavelength. The waves are lined up, and it's always in one direction. Regular non-laser light spreads out diffusely. Laser light is directional. So this is our frequency and wavelength of electromagnetic wave. An increase in frequency results in a decrease in wavelength. Okay? That's really all the information there is on this slide, but it makes sense. So here's basically our electromagnetic field diagram again. Our visible light is that rainbow section. So laser light is included in visible light. The only difference between laser and regular visible light is the coherency, the fact that it's monochromatic, and the fact that it's directional. So a laser is going to be one of those wavelengths within the visible spectrum, but it's going to be monochromatic, directional, and coherent. So all of the other EMR applications, shortwaves and microwaves, as in diathermy, infrared, which is out of the visible spectrum, and UV light, which is also out of the visible spectrum, they're all on this continuum, as well as X-rays and gamma rays. So light sources include glass tubes, fluorescent lights, and true laser is a glass tube light source, and diodes, light-emitting diodes, the slow laser diodes, and the laser diodes. So those are all applications. Visible light is between 400 to 650 nanometers in wavelength. Infrared light is greater than 650. And longer wavelengths penetrate deeper. So infrared light penetrates deeper than visible light. You don't need to know about the power and the power density. If you want to, it's there, but you don't need to know about that. there are different types of light applicators that you'll see in therapy settings. These are just some examples of them from the book. What you really need to know is what applications are available in the setting that you are in. So I was talking to one of the vendors who sells all the different modalities in the region, and he was saying that most physical therapy offices, particularly private offices, do not spend money on laser or light applications because, number one, they're not reimbursed. That's one of the big drawbacks. Even though there is research to support their efficacy, insurance companies have not come along on that, and so a lot of times PT clinics that have laser light applicators will use it in conjunction with another treatment, one that they do get reimbursed for. The other drawback is that the frequency with which you need to apply the laser light in order for it to be effective is more frequently than we usually see our patients. In order to truly get the effects that we want that show up in the research, they would probably have to come in every day. And that is not usually practical in most therapy settings. So it's one of the reasons why they're not as frequently seen in therapy settings. So there are some practitioners, such as chiropractors or other practitioners, who use it, and it's the same thing. They don't do it. They do it incident with another treatment because they're not getting reimbursed for it, but they found that it's useful in their practice and they want to use it. So it's really up to the individual practitioner whether they want to invest the time and money into doing that. So there are some good research shown effects of lasers and light. They promote ATP production by mitochondria. That's pretty cool. They promote collagen production by fibroblasts. They modulate inflammation, and it's not clearly known how that happens. They inhibit bacterial growth. They promote vasodilation, and they can alter nerve conduction velocity and nerve regeneration. So those all sound like wonderful therapeutic effects. But again, there are the drawbacks that we just talked about. So the indications for lasers and light are soft tissue healing and bone healing, arthritis, lymphedema, neurological conditions, and pain management. And you notice that a lot of physical modalities are indicated for pain management. Contraindications: you do not want to directly radiate your eyes. Both the patients and the clinicians should wear goggles. I have a couple friends who are vet techs who work at veterinary clinics where they do laser treatments. For arthritis is the main indication for pets, and both the kitty cat and the vet tech have to wear goggles, or the dog. And my sister had a really cute picture of her old cat wearing the IR goggles. But malignancy is a contraindication. You don't want to use laser or light within 4 to 6 months after radiotherapy and cancer treatment. You don't want to use it with hemorrhage because it promotes vasodilation. That makes sense, right? You don't want to use it over the thyroid or other endocrine glands. So, precautions: low back or abdomen during pregnancy. Are we going to do anything to anybody's low back or abdomen during pregnancy? Probably not. Maybe some lovely soft tissue mobilization. That sounds nice. Epithelial plates in children. Are we going to do anything to epithelial plates in children? Probably not. Impaired sensation and mentation. Always precautions. If someone has photophobia, also known as light sensitivity, light applications might not be your best choice. If they have some sort of photosensitizing treatment, such as some blood pressure medications make you photosensitive, prior sun exposure makes you photosensitive, prior UV exposure makes you photosensitive. So if you have any kind of medication or pre-treatment that is a photosensitizer, that is a precaution. Potential as adverse effects: exposure of eyes to laser can cause retinal damage. That's a pretty big adverse effect. You want to be aware that there are sometimes reports after application of laser of transient tingling, mild erythema, which is redness on the skin, potentially a rash, a burning sensation, increased pain and numbness, and potentially burns from a warm diode. When you use the cold laser, usually don't get that. Here's a picture of the protective goggles that people should wear while they're around a laser. And so these are potential adverse effects. Some people report these things, some people do not.